Hey everyone, welcome back to Urology 101. I'm James Farrell. Urology 101 is my video blog. It's on common topics in urology that are often taboo or embarrassing just because we talk about sex organs a lot. Now, my content is focused on communicating some useful medical knowledge to you, and my goal is to get you some practical advice that you can apply. This video and all my other videos you can find on my website. It's urology101.com, and the first part of that is spelled Y-O-U-R. Now, perhaps you're watching this on YouTube. All the videos are there as well. Thanks very much for checking in. Definitely check out my website too. I also post content daily on Instagram, or at least most days. But short format, great stuff. Definitely check that out. All of the accounts are the same. Urology 101, it's all spelled the same way. With that, let's move on to today's video. So, most days, I will see a woman in my clinic who is in her 20s to 30s for recurrent urinary tract infections. And very, very likely, she has been to urgent care centers, ERs, primary care physicians, and everybody's told her that she has chronic UTIs. And a lot of times there will be some labs and some urine studies. And take a look at those. The urine analyses look pretty normal, and there are no positive urine cultures, or maybe there's like one positive culture. And maybe you're the type of person who has this story. So one of the first questions that I will ask the person when I sit down in front of them is to say, look, when you get antibiotics, do your symptoms go away? Like, do they go away for weeks to months? And sometimes the answer is yes. And sometimes a woman, hey, I get 3 or 4 UTIs a year and this is the deal. And that's a different conversation. But a lot of the times when you ask that question, do your symptoms go away with antibiotics? That patient will look at me and go, no, they don't. I don't know what's going on. If that's the case, a lot of times what we're thinking about then is something called painful bladder syndrome. The medicine-y term is interstitial cystitis. And if you're a guy, we tend to call it chronic pelvic pain syndrome. So there you go. We got 3 terms for one thing. Suffice it to say, it tends to be this. Lots of voiding symptoms and sounds like UTI, but negative urine culture. And there are a lot of associated group symptoms with it, and they kind of mix and match. But the common ones tend to be that a woman specifically will feel a lot of pain above her pubic bone. And a lot of times it almost hurts to hold on to urine. So like as she gets closer to urinating, it hurts more and more. Maybe it burns when you urinate, but right after urinating, maybe all that pain goes away and you feel a lot of relief, and then it like slowly builds up again as the urine fills in the bladder. And we'll talk about why that may be the case a little bit later. Also that can happen are some associated symptoms. So a lot of women will talk about pain like right at the tip of the urethra. And some of them will talk about pain right around the edges of the vagina, and that's a fancy term called vulvodynia. Sometimes people will talk about pain with sex, that's called dyspareunia, and there is just going to be a lot of general vague pelvic pain. Guys will tend to feel pain in the perineum, and it will be pretty constant. They may have gotten diagnosed with something called chronic prostatitis, but maybe it's that. Often it's not actually. Everybody's usually gotten umpteen antibiotics, and it just hasn't solved the problem. So what's actually going on? Well, if you think about the bladder and you think about the lining of the bladder, it's pretty similar to your cheek. And the bladder tries to not really cause you any problems or pay attention, right? So it fills up with urine, you don't really notice it, and then at a certain point you have this sensation that your bladder's full and you go pee. Well, that's the normal process. But with painful bladder syndrome, kind of what we think is happening, and it's a theory, but when the bladder starts to expand, it fills up with urine. It stretches, and as it stretches, you get these little cracks in the cell lining. And urine can leak through those cracks and then cause a lot of inflammation. That can cause your body to respond to that, create more inflammation. And the nerves that are there that tell your bladder, tell your brain that you need to urinate, the nerves that are there will send signals back to your brain that says, hey, this hurts, like get rid of this problem. And one of the reasons that happens is because urine is pretty toxic, right? It's the stuff that your body just wants to get rid of. It doesn't want it there anymore. So that brings up one of the first theories, which is that maybe it's an environmental thing, that some of the stuff that people put in their bodies tends to get into their bladder, and maybe there are people out there who are just more likely to have a bladder lining that has some cracks in it that then allows that urine to seep through the lining. And that sort of arrives at one of the treatment concepts, which is education about certain metabolites from foods or drinks that may cause you some problems. So let's get into that stuff. So when we're talking with a patient, and if this is somebody, if this video really resonates with you and you've had these conversations with your doctor, one of the first major things we will talk about is education on how to deal with the problem. It's important to note that this is really like a quality of life problem. So interstitial cystitis is not going to cause you bladder cancer, but it will really destroy a quality of life for somebody. So it's important to try and figure out ways to minimize how annoying the pain is and how to treat this. There are flares, so there are times when it gets much, much worse, and there are times when it gets a little bit better. So it's an ebb and flow with some amplitude in how you feel from time to time, and we think a lot of that is related to triggers. So websites are usually a good place to start. I tend to direct people to one called ichelp.org. Another one is ic-network.com. And those are good places to start with education of different foods, different diets, people's stories, what have worked for them, what hasn't worked. When we talk about diets, there tend to be some foods that are the most common annoying ones, and it's all the fun stuff. Please check out websites, take a look at that. There's some ways to try and figure out what foods may be causing you a problem. Now, there are also a handful of things we can do medically. One of them are medications. Some of them are oral. There is one FDA medication. It's called FDA approved medication. The study made it a little bit better than a placebo in terms of effect in reducing a lot of the pain. And the idea is to try and replace that layer that's sort of like leaking and broken open. So the hope is that it provides a little bit more thickness to that. It may take about 3 or 4 months to actually see if it provides you an effect, but I have had some good success with that. There are a few other medications that are designed at reducing inflammation, because again, that's one of the problems. And it's a little bit of trial and error, so you kind of have to just bear with it, because it just sometimes takes some time to find a good answer for you. Another thing we can do is actually instill some fluid into your bladder that is either a local anesthetic or what we call as cocktail, and it can be some stuff that also helps replace some of that bladder lining to sort of reduce the ability of urine to seep in through those cracks. Now, that's not always the best answer either, but man, I've really had some good results with local anesthetics that we just put, that ordinarily would go in the skin, that we just instill into the bladder once a week for 6 weeks, and then just see how long a patient responds. And it's not that taxing of a treatment, provides some great relief, and I've really had some good success with that. So please talk to your urologist about different cocktails they can use if this really resonates with you. The next kind of thing we'll talk about is a lot of pelvic floor physical therapy, and not the Kegel exercises. We want you to stay away from those. But stretching techniques, even stuff like Pilates, yoga, those types of things, anything that can sort of stretch some of the muscles and provide some relaxation. We tend to think that a lot of the inflammation causes things to be kind of tight, and women who tend to have fibromyalgia also can kind of tend to get this one in terms of painful bladder syndrome. So we do think that a lot of the stretching and just movement tends to help some of the difficulty with this. And a lot of women anecdotally really do support that. So the next types of treatments that we get into get a little bit more invasive. Some people will talk about something called Botox to the bladder to try and relax the bladder. And also we'll talk about something called Hydra Distension. And what that is you're asleep and we can put fluid into the bladder and try to relax the bladder. Because again, a lot of these symptoms when they develop and cause this inflammation can cause the bladder to sort of tighten up. And so distending it or stretching the bladder a little bit and then also not doing it for a long time can really give people a lot of relief. You wouldn't think that it does that much, but it really, really does. And so sometimes that's something that's really helpful for patients. So also, if you aren't really doing well with oral stuff or some of the things I talked about, then talk to their doctor about whether they've had success with that before, because it really might be something that you find helpful. There are more aggressive things after that. There are implantable nerve stimulators. I don't think that's a great option for many people. And I have come across a few patients who have actually had their bladders removed because this is such a miserable, painful thing. So I really hope that somebody doesn't get to that spot, but that is out there as an option. I think that the biggest bang for the buck is in education, in understanding that there are going to be some types of foods and drinks that make things a little difficult. I will tell you anecdotally that I have had a handful of patients whose spouses have gotten stationed over in Germany, and they'll come back and say, look, before I went to Germany, I had so many symptoms, I felt terrible. We moved to Germany, I ate the same way there that I ate here, and all of my symptoms were gone. They weren't even there. And then I moved back here, and all of my symptoms are back. Jokingly, maybe it's just America, but I do think that there's a lot to be said for for processed foods and some of the quality of some of the fruits and vegetables, and trying to eat as healthy as you can so that you get as many nutrients as you can that get into your body in different areas. And I think there's a lot to be said for that. So I hope this has been helpful. Please check out those websites. Send me your questions. Send me your comments. And definitely try and get some help for this one if you're in this ballpark. All right, I hope that you have a great night. Take care of yourselves, take care of your families, and I will see you next week. Take care, guys.